Well, and then there's the difference in the type of client you're dealing with. For example, someone that's a D-SNP that's getting full, like, Medicare and Medicaid benefits or Q&B qualified, they're turning around and their dental plans really good.
Oh, absolutely.
Like $6,000, no copays, nothing.
That was with Aetna that had $6,000 for a D-SNP.
Yeah, these guys are getting. I'm surprised I see anyone without a full veneered pearly whites, like just because they're incredibly good because they're made for that. They're made for people that are really, really on that income threshold or even almost indigent.
Well, I think that what's happening now, and I was reading about how Medicare is starting to consider, I don't know if it's a myth, but Medicare, I don't know if there's legislation for it either, but they're starting to consider dental to be medical.
They absolutely should.
Well, when Medicare came out, they did not consider dental. They considered it cosmetic.
Yeah.
So now they're like, okay, 30 years later, they're like, teeth does have something to do with health.
Oh, there's a direct tie-in to cardiovascular disease and poor dental health.
And I think that's why these plans are starting to increase their dental significantly.
Yes, because also there have been cases where people have had issues like a rotten tooth, and then that rot and that contamination gets into your mandibular nerve, and then guess where it's going to shoot straight up into? You end up getting all sorts of bad stuff happening when you get major dental issues, and then you start getting abscesses.
Yeah.
Abscesses and infections will spread like wildfire because they're already in your digestive tract, starting in your mouth, and if that thing can last through your saliva, it's going to go run through your bloodstream.
I would not be surprised if there's some type of legislation. I know it exists. I just don't know how far it's gone.
Yeah.
If it does start to trickle into how much it's going to help with Medicare A and B.
I think it'd be great because it's a preventative service and so many other things. I know there's going to be an issue where people are like, well, I don't know if I can get this done. Well, bottom line is this.
Yeah.
You can either pay for some decent dental care or we can pay for a full cardiovascular event because it's going to end up being that. Right?
It was kind of like, remember, you were around, Frank. This was after me. But were you around for Plan J?
Oh, yeah.
So Plan J, I remember reading about it, and you can probably talk more about it.
Back in the history books?
Yeah.
Back in my day?
Yeah.
Yeah.
When you had hair. Oh!
It was so glorious. It was just full and like
blowing in the wind.
I had a fan at my desk just so I can do like the hair.
Oh.
I knew it was going to be short-lived, really.
Well, anyways, Plan J had Part D assistance. It had incremental Part D assistance to help with the drugs.
Right.
Because Plan J covered everything, just like F.
Well, and it predated Part D drug plans.
Correct. Yeah. So it helped with your medications. So I wouldn't be surprised if that is discussed at the House level, where it's like we got to get some type of assistance with dental.
Right. Well, there's also the other thing where you're looking at the overall billing of it. It's hard for a lot of insurance carriers go through things like Dentamax and Carrington and all these other dental network plans because they're so ingrained in the healthcare space and knowing what's essential for healthcare. Dentistry is a little bit different. There's usually not multiple doctors looking at your dental needs. It's one doctor who's also the provider and the servicer. So there's there's transparency, but there's also not that kind of control group. So a little reticent about it because it's like, hey, the guy that says, literally while you're there, we need to do this right now. And there's not really any time for approval. There's no extra testing. What extra testing do you have? You just did your bite films. He looked at it and goes, we're drilling now. Whereas everyone else is like, I just did some blood test. We took your cholesterol levels, LDLs, and we're going to recommend this X, Y, and Z things, which you'll know about 2 weeks from now. That's a lot of time.
That is true. Yeah, because when you correlate it, when you look at the billing for dentistry, you have a dentist, and then he recommends or she recommends like an orthodontist, a periodontist, an endodontist, like that. They don't know if they're going to get paid or not. You know, I understand that could be.
Here's also the other thing that people always forget when dealing with any dental program. They forget what the definition of emergency palliative treatment is, and that is pain alleviation and treatment. So while it might take a year for you to be able to get authorization to do a crown for some of these other ones, right? Some of those PPO plans. The Medicare Advantage ones are pretty much like immediate, you know. Right. And in some of them, like Cigna's plans, you can get 20% coverage right away. But what people are like, oh, well, I need a crown. Well, a lot of times you're not going to get a crown immediately anyway. But palliative treatments means they have to treat the pain source right away. So if you break a tooth, they're going to put a cap on it. That's a palliative treatment, and it also prevents further infection while they're doing whatever they need to do. So when I hear people like, oh, I broke a tooth and I'm just waiting, I'm like, well, you have a plan that has emergency palliative treatment. That's an emergency palliative issue. They'll go put a cap on it and your insurance will cover it. And your cap, I had a cap on this tooth because I was a loudmouth kid and got this tooth not like broken. And they were like, oh, it should last like 6 months or a year. I was 11. It didn't break until I was 35 years old.
Wow.
They're like, oh, it'll just fall out and then come get the crown on it.
Yeah.
Never happened. And then they're like, wow, that lasts a long time. We'll just put another cap on it. That's been 34, what am I, 41 now? It's another 6 years.
Wow.
I mean, sometimes these things last a really long time. So,
Depending on the damage.
right,
Yeah.
right, you know.
You just got lucky.
You can tell that to the tell that to my tooth. I mean,